This video focuses on nursing assessment of the neck vessels and heart. Viewing this topic will enhance your ability to identify common and concerning symptoms related to this body region, employ appropriate interviewing and techniques of therapeutic communication as you gather subjective data about this body system, perform a physical assessment of the neck vessels and heart, understand normal and abnormal findings as you assess, and document and communicate findings from this regional assessment clearly and accurately.
Neck vessels and the heart are key components of the body's complex cardiovascular system, responsible for circulating oxygen and nutrients via the bloodstream throughout the body. Problems in this region can affect the client's health in many ways. As nurses, we must be able to assess cardiovascular symptoms and risk factors, and to do so accurately requires a thorough knowledge of pertinent anatomy and physiology.
The vessels of the neck most pertinent to this assessment include the external carotid artery, internal carotid artery, left and right common carotid arteries, external jugular vein, and internal jugular vein. The heart is situated centrally in the chest, protected by the sternum. The top of the heart is called the base, while the bottom of the heart is called the apex. The arterial great vessels include the aorta and the pulmonary artery. The venous great vessels consist of the superior vena cava, inferior vena cava, and the pulmonary veins. The continuous rhythmic circulation of blood is accomplished by the regular contraction and relaxation of the heart. The contraction or squeezing of the heart is called systole. The subsequent relaxation of the heart is called diastole. Together, these comprise the cardiac cycle. The heart is enclosed by a tough pericardium. The area of the body over the heart and thorax is called the precordium. Common and concerning problems of the cardiovascular system include chest pain, dyspnea, orthopnea, and cough, diaphoresis, fatigue, edema, nocturia, and palpitations.
It is important to ask your client about each of these concerns. Whenever the client indicates a positive response, use effective communication techniques to gather more detailed information. For example, Mr. Powell is a 57-year-old man visiting the healthcare facility today for his annual physical examination and health screening. Mr. Powell has a history of slightly elevated blood pressure.
How long does it last when it does occur? Hi, Mr. Powell. I'm Tim. I'll be your nurse today.
Hi, Tim. How are you?
Start your interview by establishing rapport. Introduce yourself to the client. Explain why you are conducting the interview and how your session will proceed from health history taking through the physical examination. Employ therapeutic communication techniques to identify immediate concerns and to address the client's holistic needs as well.
Yes.
Now, I was looking at your records. Mr. Powell, your blood pressure is elevated. In fact, it's increased a bit from a year ago. Today it is 150/90. I also have some notes in your file that you've been concerned about your heart health because of what's happened in your family.
Yes, my father died of a heart attack at age 60. That's only a couple years older than what I am now. So yes, I am concerned and even worried sometimes about my own cholesterol, my blood pressure, and any other heart-related issues.
Well, I understand. It's only natural to be concerned, especially in light of your family history. Well, you've been keeping up with your annual screenings, and other than your blood pressure, your vital signs are within normal limits. Your body mass index is 29. That's slightly above where we want it to be. A bit later, I'll offer some suggestions to address that as well as your high blood pressure. Now, your last lab report is from a year ago, at which time your cholesterol and lipids were within normal limits. I'll suggest new labs today so we have a better idea what's going on with you right now.
Okay.
Other than your heart health, is there anything that concerns you?
No, there's nothing else.
How do you feel about your health overall?
I'm fine. I think I'm in pretty good shape.
Okay. Well, I see that you weren't on any medications the last time we saw you. Have you started any new medications since that visit?
No, I haven't.
Okay. Mr. Powell, do you experience any chest pain, tightness, or palpitations, that is, rapid heartbeat or irregular heartbeat?
No, I don't.
Do you tire easily?
No.
Do you experience any shortness of breath or have difficulty breathing?
No, I don't.
Okay. How often do you get up to urinate at night?
Maybe once. Sometimes not at all.
Do you experience dizziness?
No.
Have you noticed any swelling in your feet, ankles, or legs?
No, I haven't.
Continue to explore aspects of the client's health history, family history, and life circumstances to ensure a comprehensive reporting of data.
Okay, Mr. Powell, you told me that your father died of a heart attack when he was 60. Any other close family members that have had heart problems, such as high blood pressure, heart attacks, coronary artery disease, elevated cholesterol, or diabetes?
My sister, about 2 years ago, had a heart bypass operation. She's 58 now. Yeah, that was about 2 years ago.
Okay.
So yes, other than her, there's no other family member that I can think of that has those problems.
Okay. Mr. Powell, your chart says you used to smoke but quit 15 years ago?
Yes, and I have not started back either.
Good for you. Do you use any recreational drugs?
Oh, Lord, no.
Okay. Do you experience any stress in your life?
Nothing out of the ordinary. I have no complaints.
Okay. Mr. Powell, describe for me what you eat throughout a typical day.
For breakfast, it's about the same cornflakes with 2% milk. I do put jam and butter on my toast and orange juice. For lunch, I eat at the company cafeteria. They serve hot meals like roasted chicken or lasagna. I may have a salad with that and apple juice. I will have a cookie for dessert, though. For dinner, it's whatever my wife cooks, casseroles, stews, fried chicken, meatloaf, with vegetables and a potato. May take water or milk with that. We try not to do desserts at dinner.
How would you describe your portions?
They're probably too big.
Okay.
And I do seconds every once in a while.
Any snacking during the day or in the evening?
I may get a candy bar or a bag of chips out the vending machine.
Do you consume any alcohol in a typical week? And if so, how often?
I don't drink. I haven't had a drink since I got out the Army in 1978.
Let's talk about exercise. What types of exercise do you do and how often?
Oh, exercise. Oh. I sit at a desk all day. I don't get much exercise. I may shoot some hoops with my grandson on the weekends. I do mow the lawn, however,
Okay.
but that's about it.
Be sure to review all pertinent health promotion measures. For example, assess through questioning whether the client is aware of nutritious snacks, healthy substitutes for high-fat foods, and the risks of not getting enough exercise. Be aware that ethnicity is a factor in developing coronary artery disease. African Americans, Mexican Americans, American Indians, Native Hawaiians, and some Asian Americans have a higher risk, possibly due to their higher rates of hypertension, obesity, and diabetes. Take advantage of opportunities to provide information and education about these issues. After completing your subjective data collection, document your findings in the client's health record. Be sure to report both positive and negative findings clearly and accurately. Provide details about any positive findings to give as clear a picture as possible about the client's current health concerns.
Mr. Powell, a 57-year-old African-American man, is an established client who presents to the clinic with concerns about heart health. His father died of a heart attack at age 60. Sister had bypass at age 58. No other family history of cardiac disease or diabetes.
After interviewing to obtain subjective data, assess to obtain objective data. Your physical assessment of the heart and neck vessels will generally involve inspection, palpation, and auscultation. Be sure to prepare by performing hand hygiene and warming your hands.
For learning purposes, this video will demonstrate a comprehensive physical examination of the neck vessels and the heart. In actual practice, nurses may use only a subset of these techniques depending on the client's chief concern, the healthcare setting, or other parameters. The following tools and supplies are generally used in examinations of the heart and neck vessels: examination gown and drape, stethoscope, watch with second hand, and examination lamp.
For assessment of the neck vessels in the heart, expose only the area of the thorax you will be examining.
When assessing neck vessels and the heart, keep in mind the following pointers. Make sure you understand the anatomy and function of the heart and major coronary vessels. Although complete instruction about pulses, heart rhythms, and heart sounds is outside the scope of this video, become familiar with both normal and abnormal qualities in these areas. And be aware of normal variations in obese, middle-aged, and elderly clients.
Begin by inspecting the neck vessels with the client lying supine with torso elevated to 30 degrees. Using tangential lighting, observe the jugular vein. Then repeat your observation at 45 degrees, 60 degrees, and 90 degrees. At each step, look for a distension of the jugular vein. It should not be distended, bulging, or protruding at 45 degrees or greater.
No jugular venous distension.
Prior to auscultating, use an alcohol swab to clean the diaphragm and bell of the stethoscope, and warm the bell with your clean hands before bringing it into contact with the patient. Now auscultate the carotid artery. Normally, you will do this if the client is middle-aged or older, as in this case, or if you suspect cardiovascular disease.
Okay, Mr. Powell, I need you to turn your head away from me. Good. Hold your breath.
Place the bell of the stethoscope over the carotid artery, with your client holding his breath. Breath sounds will not conceal any vascular sounds. Auscultate the other carotid artery in the same way.
Pulses 2+ with no variation in strength from beat to beat, equally strong. Contour normally smooth and rapid on upstroke, slower, less abrupt on downstroke. Arteries elastic, no thrills, murmurs, or bruits. Okay, Mr. Powell, I need you to turn your head for me a little bit. I'm just going to palpate your carotid arteries.
Next, palpate each carotid artery. Place the pads of the index and middle fingers medial to the sternocleidomastoid muscle, making sure to palpate after auscultation, as palpation may affect the client's heart rate. Palpate the other carotid artery in the same way.
Caution: when palpating carotid arteries, palpate individually and not simultaneously. And take care not to apply too much pressure, particularly if you detect occlusion, so as to avoid blocking circulation or triggering vagal stimulation.
Carotid artery strength is 2+. Pulses equal bilaterally.
Begin your assessment of the heart by inspecting the precordium for lesions, masses, or areas suggesting tenderness. The client should be supine, his head on a small pillow with torso elevated 30 to 45 degrees. Next, use tangential lighting to inspect for pulsations. The apical impulse may or may not be visible. Normally, no other pulsations should be visible.
Apical impulse not present.
Next, palpate the precordium for any lesions, masses, or tender areas.
No lesions, masses, or tender areas.
Next, palpate the apical impulse. First, help the client roll onto his left side. Then, using the palmar surface of your hand, palpate in the mitral area. Then, after locating the pulse, palpate more accurately using just one finger pad.
The apical impulse, though normally palpable, may not be palpable in obese clients, clients with large breasts, or in older clients due to increased antero-posterior chest diameter.
Apical impulse discrete and tapping at the fifth intercostal space, mid-clavicular line.
Next, palpate for abnormal pulsations using your palmar surfaces to palpate the apex, left sternal border, and base.
No pulsations or vibrations palpated in areas of the apex, left sternal border, or base.
Next, auscultate. The 5 traditional areas of auscultation are the aortic area, pulmonic area, Erb's point, the tricuspid area, and the mitral or apical area. Because these areas actually overlap in practice, and heart sounds can be heard all over the precordium, it is more effective to auscultate in several of these larger areas: aortic, pulmonic, left atrial, right atrial, left ventricle, and right ventricle. Auscultation of the heart is best performed from the client's right side, with the client supine and the head of the exam table or bed elevated to 30 degrees. It is often helpful to close your eyes when auscultating to help you focus on sound and eliminate visual distractions. Begin auscultating by placing the diaphragm of the stethoscope at the apex, listening for heart rate and rhythm. Regardless of age or gender, the rate should be 60 to 100 beats per minute with a regular rhythm.
Pulse is 72 beats per minute with a regular rate and rhythm. Mr. Powell, just breathe normally. I don't need you to hold your breath this time.
Next, auscultate to identify the heart sounds S1 and S2. Place the diaphragm over the 5 areas previously shown. Listen also for murmurs with the diaphragm. And with the bell at each area. Murmurs are also affected by the client's position. So in addition to auscultating with the client supine, auscultate with the client in a left lateral position, placing the bell of the stethoscope at the apex of the heart.
Okay, I need you to lean forward and exhale for me.
And then auscultate with the client sitting up. Auscultate with the diaphragm over the apex, then along the left sternal border.
S1 and S2 heard. S1 distinct, loudest at the apex. S2 distinct, loudest at the base. No extra heart sounds audible, no murmurs.
While the skillful assessment of neck vessels and the heart requires significant study and practice, it deserves your dedicated effort because accurate gathering, documenting, and communicating of subjective and objective findings in this area can help to optimize a client's existing function and initiate critical steps for any needed interventions. After completing your objective data collection, document both positive and negative findings, using the correct phrasing as demonstrated during the assessment. Mr. Powell's condition has changed from his last appointment. His blood pressure has gone from 130/70 to 150/90. Otherwise, today's results continue within the range of normal for his age and existing medical diagnosis. To continue to help preserve his function and to encourage improvement in his blood pressure, the nurse reviews ongoing health promotion measures. It is often most effective and efficient to weave patient education throughout your interaction with the client. Today, the nurse concludes the session with Mr. Powell by ensuring client understanding about risk factors, including cigarette smoking, a sedentary lifestyle, and elevated cholesterol. The importance to heart health of a balanced, low-fat diet, a smoke-free environment, and regular exercise. The value of regular screening for diabetes and cholesterol. The methods of treating high blood pressure. First, diet, exercise, and weight reduction, and second, medication if necessary. Today's findings will lead Mr. Powell's primary care provider to refer Mr. Powell for lab work to determine current levels of cholesterol and lipids, and to schedule a subsequent BP reading. After determining that Mr. Powell's lifestyle changes have not reduced his elevated blood pressure, Mr. Powell's primary care provider will also prescribe antihypertensive medication.